All right, welcome everybody. Thank you for coming today to a Q&A session to start Mental Health and Carers Week. Before we start, I'd like to acknowledge the traditional custodians of the land and where we all gather. Today I'm sitting in Tenerife, which is Turrbal and Yagara people, and I'd like to pay respects to elders past, present and emerging. I'd like to introduce our guest speakers today. I'm just going to read them off the list so that I get everybody's job titles correct. But we've got Ivan Frkovic, who's Queensland Mental Health Commissioner. We've got Professor John Allan, who's the Executive Associate for Mental Health, Alcohol and Other Drugs branch. The Mental Health, Alcohol and Other Drugs branch are the branch of Queensland Health who fund Arafmi's carer support team. So we're incredibly grateful to them for their ongoing financial and other supports. We've got Sergeant Nick Evans from South Brisbane Vulnerable Persons Unit. I think for those of you who've been at our last year's conference, Nick's been a very popular panellist and has quite a lot to offer our carer space. And we've got Adam Campbell, who's Manager of Community Engagement and Volunteering at Wellways Australia. Adam, can you give people a wave? Just a bit of just let them know who you are. So yes, Wellways have recently come into the carer space in Queensland, and Adam will give you a little bit of an overview of that during the course of the session. So we're booked until about 12 o'clock. Hopefully we can keep everything to time here, but I might just start with a little bit of an overview on what Arafmi's been doing since the carer conference, and I'll try and keep it to just a few minutes. So in addition to our regular services, which is our 24/7 telephone support line, our carer support groups, our carer education and development programme, and our one-on-one counselling, we've developed two other programmes, one which was in critical need in response to COVID-19 and the pandemic that's been across the world. So in March, Arafmi moved all of our services online, which included group supports, one-on-one counselling and our carer education programme. But we were very lucky to be supported again by the Mental Health and Alcohol and Other Drugs branch to provide a different type of service in relation to COVID-19. So we're in the process of developing a carer support library for online supports. So we've been given funding to purchase some tablets and data to allow carers in our rural, regional and remote areas to join in with all of the group supports and the one-on-one supports that we have online. We're in the process of rolling that out at the moment, and it's still probably a few weeks away from implementation. But that will allow people who traditionally haven't been able to access our face-to-face services a chance to join with your peers online and connect with your communities in a more visible way using online resources. So Professor Allan's here representing the branch, and I do want to extend Arafmi's very significant thanks to allowing us to be able to fund this project. It will be running up until the end of June 2021, and Arafmi are hopeful that we'll carry that on self-funded following that project. So we hope that project will stay as long as we can manage it. The other area that we Arafmi are looking at is carer mapping response. We know that there's a gap in services at the moment for people who have newly become carers of loved ones of people who've become unwell, and how people navigate the system of even knowing how to get to areas like Carer Gateway or finding Arafmi. So we're in the process of implementing a programme called Carer Map that will help pave the way for carers in a more friendly way. You can pick up the phone and talk to us, or we'll work with you one-on-one and teasing out what you need for services and help you find that, so that you're not alone in the process of trying to access support. So that's what we're doing with Arafmi, but I might push to the Q&A. And one of the questions that we asked was asked by carers are, are there any new treatments or developments within the mental health sector? So I might, for the first part of that question, hand over to Professor Allan around the treatments and developments in mental health in particular. And then, Professor Allan, when you're finished, I'll hand over to Ivan as Commissioner for Queensland Mental Health Commission around some more policy development, if that's okay. And I'll maybe just give you 5 to 10 minutes to speak each, if that's all right.
5, hopefully. So stop me if I go over 5.
Cool.
Look, I think there are 2 different groups of treatments that are actually emerging and people are talking about a lot. One is in relation to psychotherapies and organisation of services. I think that one of the things that people are really doing is thinking a lot more about self-responsibility and organisation of care. So in the UK, for example, there's a movement called social prescribing, which is really helping people with sort of mild to moderate illnesses. And it's about, actually saying, well, let's take a good look at your lifestyle. Let's actually take a good look at the positive things you can do for yourself rather than just relying on medication and taking that as a first line rather than medication. I think that's a really good thing. Secondly, I think COVID has taught us a lot about collaborative care. So particularly for people who have physical side effects from mental illness, who might, we've had a lot of success with smoking cessation programs, for example, which really improves people's health and actually ends up means they can take less medication and they end up with an incredible improvement in their mental health as well. So I think I've probably spoken at these meetings before about my enthusiasm for things like smoking care and physical health care and doing that. In terms of the medications, there's a fair bit of stuff out there and it's a bit controversial at the moment. So I just want to mention a couple. People may have heard of these and stop me if they have or want to ask any questions. One is around a drug called ketamine, which or S-ketamine as well, which is a derivative of ketamine. So ketamine is a drug that's been around for a long time. It's actually used as a tranquilizer. It started in the veterinary world as a horse tranquilizer, but has some mind-altering properties, including anesthetic properties. But in smaller doses, people have claimed that with a small dose of ketamine, they've had very good effects on their depression. Now, this is really quite an unproven and unsustained treatment in some ways, but it's getting a lot of publicity. And there's a version of which you spray in your nose, S-ketamine and this stuff, and people have been promoting that. So you may have people talking about that. At the moment, I would follow the position statements of the college, which say, look, it's really still in its experimental phases, but there's been a lot of talk about that. That's one. The other medication that's probably, or medications that are even older and coming back, you may have been exposed to people talking about psychedelic therapies. So this is the notion that came from the 1960s that drugs like LSD and psilocybin, okay, which is the active thing in mushrooms, can have a positive effect. And so there's some experimental work which is quite limited, which is now coming out and being promoted though around the world because it's very exciting because you're using illicit drugs to do things, where by giving people small amounts of these drugs, and they include also MDMA, ecstasy, small amounts, very low doses, and associated with psychotherapy, that you can help people have an experience where they can go through their experiences and overcome things like PTSD and depression. Now, again, these are very, very experimental, and but there are some trials beginning in Melbourne. There's been trials published overseas around that. So I think we need to treat those two things with incredible caution in relation to what we do. But I just want to sort of put them out there. People hear about that stuff, but I'll be very, very cautious about that, about those things. And the reason I raise them is because the psychiatric drug development world has lost a bit of interest and impetus, okay? They're looking for old compounds to do new things. There's not a lot of money going into psychiatric drug development. So a lot of things that we have as our mainstay, like the antidepressants and drugs like clozapine and so on, do remain the mainstay for us. So that's very important. So I just want to get rid of the drugs. And I think the question was also, tells us service, support, carers, treatment options for people with borderline personality disorder. So yes, there's very good evidence about borderline personality disorder. 3 bits of evidence are really important. One is that for some people there can be a biological change, and so sometimes medication as an adjunct is helpful, like antidepressants, but that's not the main thing. The second thing is that the psychotherapies that are used in borderline personality disorder are actually incredibly effective, okay? So you can actually form a relationship like DBT and other things that are used, if done properly, can actually be very helpful to people to change their trajectory and outcomes. And thirdly, that there's a lot of stigma involved in borderline personality disorder. We've been going through a lot of work, particularly services are very interested in improving the capacity of services to help deal with people with borderline personality disorder. So one is about overcoming the stigma, making sure the staff understand what's actually going on and can give a decent response, ensuring that there are more people able to give those kind of therapies and give the kind of brief interventions to help people get out of trouble rather than into trouble, which often happens in borderline personality disorder. So there's, and I think that in the last 5 to 10 years, but even more recently, hopefully in Queensland, the whole system of treating and attitudes to borderline personality disorder is changing. So is that enough? I'll stop. Go for other questions.
Thanks, John. I really appreciate that. What I might do then is hand over to Ivan.
Are there more than 10 sessions?
Yeah.
So people with more than 10, so for psychiatrists, you get more than 10 sessions. If you've got borderline personality disorder, you get the 50, and then you can, the total number of sessions you can get is 200 and something in a year if you get the right plan. So there's the question. Sorry. Apologies.
No, that's okay. And I think, John, we can certainly, with any of the questions that have got very specific answers to them, we're happy to send those out to the panel and the membership after the meeting, just for those very intricate areas. And if there are questions directly related to navigating or trying to get services, Vanessa, we can certainly answer them off outside of the Q&A. We'd be happy to talk to anybody directly about what supports they might need and how we can help them try and access it. So thank you for that. Thanks, John. Ivan, can I hand over to you just in terms of the question around mental health sector, but also, are you happy to talk a little bit about mental health and Carers Week in general and what the Commission's been up to?
Look, yes, I can. Thank you very much for the opportunity, and it's great to talk to particularly families and carers in the main, but also generally around the important role that families and carers particularly play in our overall system. And I won't go into the data and the information, which clearly says, you know, that the contribution is in the billions of dollars, and clearly the system could not cope if we didn't have families and carers doing what they do every day. And so that's why it's really critical. And I know this year Mental Health Week and Carers Week sort of overlap, but in some way I think that is a good thing as well. The importance of both is just so critical in our system, both people with the lived experience, but also their families and carers, because one without the other, you know, just doesn't work. And if we didn't have families and carers doing what they do, and if we didn't continue to raise the importance and the needs of carers in the context, you know, that would not, you know, I think help us in terms of being able to meet the needs, you know, that we have, as, you know, John mentioned, etc. But what I thought was, apart from talking about that, I thought this year, particularly with, you know, the COVID environment, the importance of looking after our mental health is probably more important than ever, and particularly for families and carers. As I, you know, say very generally and publicly, we are all more vulnerable at this particular point in time. You know, from a person that was living without any mental illness, etc., prior to this, and, you know, most of our population is well and psychologically strong, to people that were living with mental illness and their families and carers across all of that, we are all now more vulnerable in terms of our mental health and psychological needs. Our level of mental health vulnerability has certainly increased, and John and I can talk to you about some of the increase to some of the services we've seen over this time when we compared to last year. That wasn't in the COVID environment. But what I wanted to say was that in terms of particularly assisting carers, there is also been a huge investment, particularly around trying to provide additional services and responses to people with mental illness, which obviously will also assist carers. In last year's budget, and I won't talk about the sort of too much, and John and I can talk about, we've certainly shifted the system about focusing on those crisis responses. So, you know, things like the Way Back service, where people get support after they're presented to ED with suicidal ideation, rather than just going home to their families and carers, they can get a whole range of additional supports. We've seen for the first time in Queensland and probably Australia, the establishment of a crisis stabilisation unit, an alternative to an emergency department at the Gold Coast. Not many jurisdictions have this in Australia. In fact, I can't think of one, John, you may be aware, but I think we are one of the first ones trying, because don't forget, mental health is retrofitted into ED. ED is for physical and medical emergencies. We retrofitted that. But I think we're now realizing that's probably not the best environment for people with mental illness and drug and alcohol and suicidal ideation. So really rolling out this new model at the Gold Coast to be able to see how that works. But also just providing alternatives to ED, things like those safe spaces, safe space cafes, etc. The government's rolling those out, and John can talk to you more about the details of those. But providing alternatives so that the loved ones that you're caring for and the people that you're caring for have other options without just being basically, it's not that I'm trying to be, sort of harsh on the public system, but people get turned away, and where do they go? This is an opportunity to do that. We've also seen additional investment around the non-government sector, including in organisations such as Arafmi and sort of carers organisations, but also in terms of Indigenous suicide. That was in last year's budget, and that's still rolling out, and John's group and sort of others, we're all working on that implementation. But more recently, and picking up some of the stuff that John just sort of responded to, as a result of the COVID environment, we have certainly seen the recognition of mental health as an important issue in our economic recovery. And I'll talk more about that. We've seen the federal government make substantial investments in mental health. And I just talk about a few of them, a lot of the helplines and a lot of the digital responses, things like Beyond Blue, Lifeline, Kids Helpline, eHeadspace. There's a whole range of a plethora of these things. And we've seen increase in service utilisation. But we've also seen, and John just touched on this, the increase in the number of sessions that you can have via MBS, and now with the budget announcement you can go to 20, but also online sessions. You don't have to go and see your practitioner, whether it's the GP or whether you're seeing a private psychologist or a social worker, much more online. And also there is no gap at this stage, which I think provides people with an opportunity to access those services. But also we've seen in Victoria, and John and I have certainly had this discussion around how in Victoria they're rolled out with the feds these community mental health centres, shifting the whole public system and the NGO system and the primary healthcare system in situ, in community, supporting families and carers, but also people with lived experience, obviously, who are living in community rather than all roads leading to inpatient services or ED. And finally, you've seen a huge investment by the Queensland government, and I think, Irene, you mentioned some of this. Initially, the Queensland government allocated $28 million. Yes, it's not recurrent, but a fairly quick, sizable response to the non-government sector, mental health and AOD, including people like Arafmi and other carer services, but also to the Indigenous primary healthcare community controlled organisation to respond in that immediate response when we were in the midst of the crisis. But only more recently, and John and I probably can't talk too much about this, the government announced $46.5 million of extra funding to mental health, and John and I fought this really hard. It wasn't just a health argument. We argued this in the economic space. We argued the case that you can't have economic recovery without human and social recovery. So in actual fact, if you look at this 46.5 million, you won't see it in any health or mental health plan. It's in the Queensland Economic Recovery Plan. They've actually allocated $46.5 million to actually help the community in terms of its economic recovery around its social and human recovery, particularly around mental health and drug and alcohol and a whole range of things. And that's been a whole shift in terms of where we are now. Now that's funding for 2 years. That's a sizable bucket of money. So we've seen an investment in services, which I think will help obviously people with mental illness. But on the other hand, this will be major supports for families and carers who are struggling at times to be able to deal with some of these issues on their own. So that just gives you a bit of a picture in addition to what John talked about at the treatment level, what's happening at the systems level, and how we're moving all this forward to try and respond to need and take some of the pressure off carers, but also to see how we can support carers in this whole new world.
Well, thanks, Ivan. That's a lot. But thank you. And John, did you want to add anything to any of the comments that Ivan had made? I know, and what's incredibly reassuring is that Health and the Commissioner are working very closely together, and it's really clear that you're talking on a regular basis. And it's good to hear those references.
Look, I think Ivan's already said it all. Just to say that we've had quite an increase in presentations for people with suicidal distress coming to emergency departments and other places, like about 14% this year. We've had a slight increase in the number of people presenting for community mental health treatments. It's starting to settle back a bit, and the sort of number of people for admission is around what we've had last year. So, but there's been quite an increase, and as you know, the helplines have been quite high. And I think the issue is that we are very lucky in Queensland that we have not seen this, but of course there are also mental health issues for people who've been affected by COVID. So there's a higher rate of anxiety, depression. People talk about difficulties in thinking post-COVID and so on. I mean, the present presidents aside, that a lot of people have had a lot of problems with that. So we're very lucky to have avoided that. But there's no doubt, as Ivan said, that there's a direct link between economic stress, job loss, loss of income, and mental health outcomes, which we all obviously know. So it's been very good to be able to do that. I can't really talk about all the details of those programs. We're just the caretaker mode at the moment. But I think that we're going to have to face this for a number of years. This is really early. The other good thing, and that's now become public, is that the data, well, good thing, but terrible thing, is that the data about suicide has now been published. There was a prediction that the number of suicides might increase. We have the same number of suicides at this time of the year as we had last year. Now, that is in itself a terrible thing, right? So, but it hasn't increased. That's something, and we don't know whether it's because there's different ways people are thinking about COVID. There's been some terrible events, and there's been some, obviously good events. But we do know that distress piece has really ramped up, and we've had to ramp up our responses to that. And I think that's probably the most worrisome thing to me is how long will that go on? How long will people feel like that? And what can we all do to make sure that that's not so? With all those new models and things that we were doing before COVID, but we just have to really ramp up in COVID.
Thanks, John. And certainly one of the worrying things that we had from last year's Carers Conference, when we were promoting becoming visible and having conversations with carers, the year before last, carers were really worried about their loved ones dying by suicide. And last year when we talked to carers, I was really quite disturbed with the level of carers who were experiencing thoughts of suicide themselves, because they were experiencing hopelessness, and we were incredibly concerned moving into COVID that carers weren't able to take a break from their caring role, especially because of all of the restrictions. And we certainly saw an increase, in particular in regional areas, of people contacting us asking for supports. So, and I'm glad that we've been able to provide that, and Queensland Health have been very generous in their ongoing support. One of those areas that I want to then move on to is some of the other networks and supports that are around for carers, and particularly in the mental health space, but carers in general. So I'd like to hand over to Adam Campbell, who's the Manager of Community Engagement and Volunteering for Wellways Australia. Adam, are you happy to talk a little bit about the Carer Gateway and how carers can access more support, and maybe if there's anything specific around the mental health space?
Yes, absolutely. I should just clarify my job title, Irene. I'm the Service Manager for Queensland 1, which is basically Southeast Queensland for the Carer Gateway.
Sorry about that, Adam.
Well, it's totally fine.
Yeah, you can see them rolling their eyes now in the other two.
Yeah. Although I do support a coordinator for community engagement. It's a big part of what we do.
Apologies for that, Adam. Thank you.
People will have varying degrees of knowledge and understanding about what the Carer Gateway is and what that reform has sort of meant in the carer space. But by way of a rather succinct summation of it, Carer Gateway is a piece of national reform. We've seen the previous way that we funded carer supports in this space cease around March this year, and the Carer Gateway launch on April 6th this year. So some things look a little bit similar to how they looked in the past, and a good example of where things look very similar would be in the face-to-face counselling space. So carers who contact the Carer Gateway can absolutely access up to 6 sessions. It's actually a little bit more flexible than that, at no cost to themselves. Carers can call up the Carer Gateway and get information about services and supports that might be useful to them. And we conduct referral and that sort of thing. And in that sense, things look a little bit like how they looked in the past. Where things look a little bit different, the first thing that pops into mind would be the support group space. In the past, and I was a support group facilitator for Carers Queensland for a number of years. You know, support groups would enjoy facilitation for a number of years. That's quite different under the Gateway model. We facilitate between 4 and 6 sessions now, and they're very structured with a view to groups moving on to a self-facilitated model. Now that's not Wellways design, and I would say that none of the Gateway is. The point of difference between how things work in the carer space now and how they worked in the past is the Carer Gateway design was conducted by the Department of Social Services. So quite a lot of co-production was engaged in order to develop what we have now, which is a suite of programs designed to support all family carers. But it's our job at Wellways, and Wellways are rolling out the Carer Gateway in all of Queensland, to actually roll out this design in a way that overlays onto communities in the best way possible. And I guess what that means is figuring out what parts of the model need to flex a little bit in order to, you know, serve the interests of carers in the community. I think there's certainly a lot of challenges for us rolling out the Carer Gateway, and one of them would be that area of support groups where people have enjoyed long-term group facilitation for you know, a period of time, moving into a much briefer short-term model of facilitated support. And I absolutely appreciate people's concerns in that space. We're just trying to help community groups actually move through it and see what we can actually get from this design, because I think there's a lot to be gained. Some of the other things that look a little bit different to how they looked in the past, we engage any carer who comes through the Carer Gateway should come through a planning conversation first. And it's a little bit of a point of difference how things worked in the past, because in the past, a lot of services were extremely flexible, not a lot of assessment at the point of intake, and potentially some points of that exploratory conversation weren't explored as much as they could have been. So one of the parts of the Gateway design that I really like is the fact that carers contact us on our 1-800 number, and I'll put that up in the little chat box once I'm done here, Irene, we conduct a carer star. So what that is we talk about 7 different life domains for that carer, how are things going for you in terms of your health, in terms of your ability to work, how you're managing at home. And on from that, we actually develop a support plan with every carer accessing a service in the Carer Gateway. So in that sense, we have that robust conversation at the point of intake, and if things are working the way they should, we get a better sense of where to load in supports for that carer. I'll drink. So I think we are doing assessment quite well. And the other thing, I suppose, and this has generated quite a lot of conversation in the community space, stakeholders and carers alike, is we've actually got a little bit of funding that we can load into carers' plans. And the maximum amount of that funding is $3,000 for a carer per year. And we tie that back to, you know, that person's individual context, what is their need, and, you know, what would make a difference in terms of bringing this plan to life and getting that carer through what is effectively a 3-month planning cycle, you know, after which we conduct a review and check in with that person and see how they're going. So many of us in the community sector have had roles where we've engaged with people in a planning sense without any funding attached to it. It's absolutely wonderful. It's our privilege to actually develop plans with carers where we can actually load in a little bit of funding. And that's where planned respite comes in as a great example. And overwhelmingly, the key requests that we're getting in our Brisbane contact centre, located here at Mount Gravatt, is a request for planned respite. So carers overwhelmingly need to take a break. It's what you'll hear from any family carer that you talk with, and some of the people on this line today will concur with this sentiment that, you know, the caring role can be a very isolating role. It can be a very highly demanding role, and it takes its toll on a number of, you know, well-being indicators in your life, and the ability to just plan a break is absolutely key. So we get a lot of requests for planned respite. And we also run emergency respite. So the work that we're doing is basically, you know, also replace the work previously conducted by the Commonwealth Respite Centres. So out of our contact centre here in Brisbane, we also respond to emergency requests for support from carers. And I suppose I don't mind letting everybody know it's an extremely busy contact centre. So we field somewhere between 100 and 150 calls from carers every day across Queensland. And it's interesting to me because it's a contact centre model. So carers call up and they have a planning conversation over the phone with somebody. And that's a little bit different to how a lot of carer support services operated in the past, in more of a drop-in model. But what we're finding is we're actually finding a lot more what we call hidden carers. So people who haven't accessed a service in the past or may not even identify with that rather helpful label of being a carer. We're actually finding that a contact centre model is quite convenient for people where they can have a planning conversation at 8 o'clock at night. Or if they live in Chinchilla or Roma or something like that, where, you know, an area where there might not have been an office in the past. So we're actually finding the contact centre models very, very popular. It keeps us busy.
I'll bet it does, Adam. Thank you for that. And just to touch on some of the areas that you mentioned, Adam, so carer respite, certainly Arafmi used to be funded to provide that, and that funding's shifted now, but Adam and I have been in conversations around how Arafmi go about providing that again. So it's certainly on the radar for organisations like us to be providing that in the future. There's some areas we need to work on to get that up and running, but Arafmi's board are very, very committed to moving forward on the carer agenda, and carer respite's very high up on that agenda. Just also in relation to the synergies with Wellways and the carer gateway, the group supports that Adam was talking about for mental health carers, Arafmi do provide that ongoing quasi-facilitated support, so either through an employee or a peer volunteer. So where the designed intentional short-term sessions are there are other provisions that people can be referred to if they need more ongoing support, because we know that for some people short-term sessions work really well. It helps in a space, but other people's life situations might mean that they need more ongoing support, and that's where Wellways and Arafmi are working really well together to ensure that there's good referral pathways to both. And Adam, although it's not necessarily Wellways, I do want to touch on Carer Gateway with Little Dreamers as well. So Little Dreamers is a young carers organisation, and Arafmi have just partnered with Little Dreamers and Griffith University to do a year-long study into the role of young carers across Australia. We're incredibly excited about this research. At the moment, there's not an awful lot of research on young carers, in particular in the mental health space, and not Australia-wide. So we're trying to work out the demographics and look at the impacts for young carers in terms of, pardon me, in terms of education and employment opportunities, and how we help young carers live a full life outside of their caring role. So, and Little Dreamers have come to Queensland under the Carer Gateway model. So we're very excited to have them here and representing the young carer space. Adam, thank you for that. Is there anything else you want to touch on before I move on to other areas? Are you comfortable that you've talked about Carer Gateway?
I could probably talk about the Carer Gateway all day, but I'll spare everybody that agony. The only other thing I'd probably flag, touching on what Ivan was talking about, we've been given a little bit of additional funding for carers affected by COVID-19. I'm currently having a conversation with Irene about how we can partner to better support carers, not just carers of people with mental health concerns, but carers who've actually been affected themselves. So we've gotten a little bit of additional funding to do some extra stuff in that space, which is great.
And we're very appreciative of the capacity to work together. I think that I certainly haven't experienced any silos in the service provision space. All of the organisations involved in carer space, we're very happily and supportively working together to get good outcomes for carers. It's really pleasing to see that in the not-for-profit space. Kath Ives has just asked a question: is there any chance for carers retreats this year? Kath, there is. Instead of holding a large carers retreat, Arafmi are holding 4 small retreats with less people in them. We'll send out the details of that again to our membership database. I think I'm looking at Leanne, who's across the room. There's four retreats. I think December, January, February. Is there one in November as well? And there's a retreat in November, but they're much smaller. And we're in the process of booking those at the moment and trying to get people in where we can. Those retreats absolutely do not replace respite, but they're more around the theme for mental health, around take time for mental health. So the carers retreats will be about self-care and looking at some fun, gentle stuff that carers can work alongside with each other. What I might do now, we've got 15 minutes before we're due to finish. Nick, are you okay if I pass on to you to talk about what the South Brisbane's Vulnerable Person Unit's doing in the space? Carers have always been very keen around this particular area. So you're happy to talk for 5 minutes or so on what's been working for you over the last year?
Yeah, absolutely. Thank you for having me. Yeah, look, we've been really lucky in South Brisbane to have an excellent working relationship with our Queensland Health colleagues, as well as QAS. So we've been doing a lot lately in relation to making sure that police response to people in mental health crisis has been really, I guess, following the Queensland Health least restrictive pathways processes. And obviously our key program that we run is the continuation of the mental health co-response program, where both police and QAS now have qualified clinical nurse consultants working alongside them every night from 2 o'clock in the afternoon till 10, when it's possible that other services aren't available. So I won't go into too much about what we do in that role, but essentially in the last 9 months, the first 9 months of this year, we've had around 415 presentations, which is slightly more than last year. We were expecting a larger increase, particularly because of isolation that COVID had the potential for creating, but we didn't really notice that. But what we have noticed is that a lot of those people who are contacting police in crisis have been able to be managed in the home. And of those 415 presentations, we've only had to use a use of force option in 2 of those occasions. So that's come down to both having a clinician on the scene with qualified mental health experience, rather than relying on police to do essentially what is a health job. But also, I think a lot of it is around when we do go there, there's informal education of those officers that are attending, so they get to see the way that a mental health clinician deals with the situation, and then they use those skills moving forward to other jobs as well. So as I said, yeah, we've got a 7-day-a-week program now. There's 2 police and Queensland Health clinicians. One's based in Campbell, one's based at Logan, and there's a QAS co-responder as well, who are also based in Logan but travel right through Metro South Health Hospital and Health Network. So I think focusing on the carer side of things, one of the I guess the really positive things to come out of the co-response model is our ability to do referrals, but not only in terms of mental health referrals, but obviously there's a lot of situations that have comorbidity factors, particularly around domestic violence or drug and alcohol abuse as well. And the network that we've built with other service providers in these areas has really led us to be able to target those other problems and those underlying problems, and particularly with carers, give them some really solid advice and solid referral options to address those other issues. And I think because of the established networks that we've created now with those other service providers, we are able to link people in with the right part of those organisations. A lot of the time it's quite difficult to navigate those organisations coming in without, I guess, any knowledge. So because of the fact that we're dealing with them all the time, we really have been able to streamline that process. And just in relation to one of it was interesting that Vanessa brought up about borderline personality. Quite a significant part of our workload is dealing with people with BPD or emerging personality disorders. They're probably the one of the best opportunities for us to engage as a mental health co-responder in that situation, because what a lot of the time people in with those personality disorders really are looking for when they're calling emergency services is, I guess, some attention, well, not attention, but some assistance and some, I guess, some pathways forward to address whatever they're going through at the time. And a hospital situation, particularly ED, isn't necessarily the best environment for them. So we've been really successful with a lot of the presentations around people with BPD in I guess, keeping them at home and giving them other referral options and pathways that are probably more suitable for what, their situation at the time. So yeah, we're going to keep going with this, and what I really want to promote is that, if carers are concerned about their loved ones and they want to, get hold of us and get us out, it's only a matter of calling police, and we're more than happy to come to any situation and offer any assistance that we can. So please don't feel like calling police is a last resort. If you're in a situation where you can't handle the problem yourself, we're more than happy to come out. We want to do that before it gets to a really critical situation.
Yeah, thanks, Nick, and it's incredibly reassuring to hear the police side of it. It's absolutely coming from a place of care and looking at the most positive outcomes and options for people. We've got just a question around this, if I can ask you if you're able to touch on just briefly, and then I'm going to do a bit of a quick summary. But the question is, do Queensland Ambulance Police and Health have training sessions for response to things like, for instance, mental health orders, and extended to the wider workforce to provide a timely, coordinated response, not just a police response? It's probably quite a multi-layered question. That probably quite a few areas, but in terms of just the QPS perspective, are you able to talk on the training sessions in particular around mental health?
Yeah, absolutely. Last year, we actually reviewed our training processes in relation to mental health, and a new package was developed. One of the sessions in that package is about mental health orders and examination authorities, and the authority to transport absent patients from hospital as well. So there is knowledge around that. It's obviously developing, and it's a process which will take a while to flow through all of our organisation. We've got around 12,000 officers. However, there is a lot more knowledge coming into the service, and particularly with the advent of so many co-response models throughout the state, there is a definite increase in knowledge, and we are working with Queensland Health as well. Whenever we do training in South Brisbane, they're an integral part of our training. So yeah, definitely, lots more training that is happening, and it's just a matter of time in terms of you know, getting more knowledge in our organisation.
Yeah, thanks, Nick. I really appreciate that. We're close to the end of time, and I think if there are any other questions that come through, we'll aim to answer those as a response and send them out to all of our members. But what I'd like to do is just go around to the panel, so to Nick, to John, to Ivan and to Adam, and ask you just to say a few last words. And I'm going to be really cheeky and spring this on you. So it's Queensland, it's Mental Health Week, and the theme of Mental Health Week is Take Time for Mental Health. I'd like you to think about, is there something that you're doing as an individual to take time for your own mental health? Because we do a lot, and we're embedded in the community in terms of service provision and service offerings, and sometimes we don't always stop to look at our own health. So I'm going to challenge you now to respond and go, is there something that you do to take time? So I've got a knowing smile there. So Ivan, I'm going to go to you first, if you're happy to say a last few words, if that's okay.
I will just say, look, things that I do is really, for me, it's the social connection, my family, my friends, staying connected, you know, even in these difficult times, staying connected. I'm trying to do a bit more of the sort of the physical health activity and diet and sleep and you know, those things are really important as well. But to me, I would just say, and these are some things you know, I'm trying to do as best as I can, is around, if you look at the Dear Minds campaign, which we put together with health, etc., it talks about a number of things that I think we could all do, and we should do better around staying well. You know, take time to get healthy. Physical health includes sleeping, diet, exercise. Keep learning. This is a time, and lots of people have done some really interesting things during this COVID to learn new things, etc. Keep learning is important. Show kindness. And I could talk more about that, because showing kindness has a two-way positive effect. We've seen the Care Army and the impact that's had on people. Stay connected. It's time to stay connected. Even though we are physically distant, stay connected. And also take notice, particularly take notice of and embrace our environment, our nature, etc. If those elements we can build into our everyday life, that's certainly going to help with all of our mental health. And that's what I'm trying to do every day.
Thanks, Ivan. That's a lot of things, but that's fantastic, and that's really good advice. I remember when I was growing up and working through my mental health areas, people were talking about the benefits of exercise and eating properly, and I was like, oh, so what you're telling me, just eat more broccoli and everything will be okay. But actually the taking responsibility and looking at those small changes and looking at things like your sleep hygiene actually is incredibly beneficial for positive mental health. And I do want to extend to carers where you might be struggling with that area. Arafmi will absolutely provide supports to help give you time to do that, whether that's through services or supports to your loved ones or some individualised services to yourself. So if carers are listening and going, I just don't have time for that, please pick up the phone to our 24/7 number and we'll talk you through that. Right, thanks, Ivan. John, is it okay to jump to you? And what are you doing?
Look, I agree with everything Ivan said.
That's very efficient, John.
Two things. One is that we're publishing, hopefully this week on our website, 30-second videos with all of my staff about what we do.
Sure.
And I've talked about the value of exercise, sleep, and I go for a walk every morning, actually, before I do anything. So that's very useful. But the one thing I do is actually self-reflection. Actually, because I don't know about you, but I have felt a lot of anxiety in the time of COVID. And I tell people sometimes that anxiety is quite justified. There have been quite significant things that we are facing. So it's really good to stop when you get anxious and think about, should I really be anxious about this or not? Is this justified or not? And sometimes you'll come to conclusions, well, maybe it's not justified that I'm that anxious. I need to stop and reflect and think about what it is that's making me so upset. And then, as Ivan said, make those connections, get the information, talk to people. Just centre yourself again, because we've got a long way to go here, and we need to keep ourselves in the best possible shape to help people, to help everyone around us. So, you know, those things. So that's my message.
Oh, thanks, John. And I think we've got a Pilates session. I'm looking at the market team. What days are Pilates? We've got a Pilates session online on Wednesday, and we've got we're meeting in New Farm Park on Friday at 12 o'clock. And we've got a whole bunch of different events on that'll help with that physical aspect too. Thanks, John. Adam, can I go to you? What are you doing to take time for your mental health?
Oh, that's a good question. Probably not enough. But to answer your question honestly, I've and maybe it's got a lot to do with the year that I've had, which has been rolling out the Carers Gateway in South East Queensland. But I've actually discovered that I've started to forget how to take time out and how to unwind. And the other day I thought, enough's enough. I picked the most holiday reading kind of book off my bookshelf that I possibly could. Incidentally, it was a Billy Connolly road trip book. And I decided to hit the couch and read about Billy's trip along Route 66. And actually, it was just such a nice experience actually stopping and doing something that wasn't target driven for a while. So
Yeah.
that's my new goal. More time on the couch. Usually you tell people get off the couch, but that's what I'm trying to do at the moment, to just take time out.
Thanks, Adam. And if we can do anything from a networking perspective, because we do talk to each other around services, if Arafmi and Wellways can do anything to challenge each other on, hey, let's take a step back and just be nice to ourselves for a bit rather than looking at KPIs or driving things, we're happy to talk about how we can support each other with that. But
absolutely.
And Nick, I know you've got an incredibly busy role as well, but what are you doing to take time out for your mental health?
I've actually over COVID developed a bit of a numismatic addiction, so a love of coins, and as weird and nerdy as it sounds, and my wife gives me heaps of stick for it. I've been collecting different coins, and I just love taking some time out and finding some cool coins, and that's been my escape, and I've turned it into a little sideline business as well, which changed her perspective on my coin collecting, which when the money started rolling in. So that's my little side thing. But obviously, the other thing I do, I have about a 40-minute drive to and from work, and I've been using the Calm app just to do some mindfulness there, which I find really good. I was as I think it was Kath was saying, cranking up the tunes as well. But I found sometimes I just needed some like meditation type music, and the Calm app's been really good for that. So
that's fantastic, Nick. Thank you. Yeah. We'll send out information on the Calm app and any other recommended apps that people have brought to us. I use Headspace at night, and not Headspace the service provider, but Headspace the app. I'm normally sleeping within 10 minutes of it, which is good. I never finish one. And that just adds, that's what I do to take time out for my mental health, is I make sure that I get good sleep quality and making sure that I drop off at a particular time so that I'm rested for the next day and able to be as functional as I can. Well, thank you, everybody. I really appreciate it. I really appreciate the time that the speakers have taken to give to us to share your wisdom and your knowledge. And I appreciate the time that the carers have taken to come in and listen and ask questions. I know that this year's Q&A is very different from last year. Last year we had a conference room full of 120 people. We are recording this and we will share it with all of our carers. And we are committed to providing a more full-on conference in 2021 when it's a bit safer and more relaxing to do so. The thought process of doing it this year was a bit, we felt people might be a bit uncomfortable in that crowded space too, so we hope that this has been enough to give to people for the time being. But we do have events going on for the rest of the week. They're up on our website at the moment. And please, if there are any issues or people are struggling even with the conversations around Mental Health Week, do get in touch with us. We do have our 24/7 support line, and we have our office hours open where our staff are always here. And just to reassure you that you are not alone in this space. There are many carers out there and many people who are happy and willing and engaged to support you through your caring journey. So please know that you're not alone and that we are here for you. So I'm going to just bid you all farewell now, and thank you, and wish everybody the best of luck for the rest of the Mental Health and Carers Week. And just to extend my thanks again to Ivan, John, Nick and Adam. Really, really appreciate the time that you've taken to do this, and hopefully it will benefit our carers to the future. So I'll just give everybody a wave and we'll sign off. But all the best, everyone.
Stay safe.
All the
Bye.
best.
Thanks, Irene.
Hopefully see you in the flesh one day.
One day. Take care.